Hi, everyone. Thank you for attending tonight's Ask Me Anything with Dr. Ellis. As many of you know, my name's Ruby, and I'm an academic recruiter for Aspen Dental Management. Aspen Dental Management supports all the Aspen Dentals nationwide. We are a DSO, a dental support organization with over 800 offices across the United States. You have the option to ask questions to Dr. Ellis via the question and answer little box down there. So feel free to click that and ask whatever question you may have, and I will be the moderator. And so I'm going to go through all those questions and ask her, try to put them in order. And you guys also submitted questions prior to on a Google form. So you'll see me looking this way. It's not like there's anyone there. It's just me referencing your other questions. So like I said, I'm the moderator. If you have any questions that you want to ask privately, you can totally email me, or there's an anonymous option. But like I had said, also, we are doing a gift card or 4 gift cards for the top, or I guess the most questions asked. So if you want to be anonymous for some, that's totally fine, but I need to know who you are so I can send you out that gift card too. So without further ado, Dr. Sabrina Ellis, if you could just give a brief intro.
Okay, hello, my name is Dr. Sabrina Ellis. I am a graduate of Meharry Medical College School of Dentistry in Nashville, Tennessee. I have been with Aspen for maybe half a year now, a little bit over half a year, but I've been practicing for about 5 years. What year is this? About 6 years, 6 years. And I'm excited to be here. I am
Thank you.
a mother, a wife, a dog owner.
Well, thank you for being here. We're going to hit it off right off the bat. There's already 18 questions. People are eager to ask you about your life and everything about you. So let's start with this one. Do you personally feel like there's a good work-life balance working at Aspen?
Oh, that's a good question. My answer is yes. And it just kind of depends on a lot of factors though you have to take into place. So how far is your commute, or how long is your commute? That plays a role. I did practice at an office that was about an hour and a half commute. And I felt like I spent most of my time on the road than I did with my family. Now I'm practicing 9 minutes from home. I go home for lunch. I had a newborn right before I got here. So for you moms or future moms, or, I nurse. So I went home and I nursed every day during lunch. I'm usually out on time, except for today. Today, I'm still here, but it happens. It happens whether you're with Aspen, it happens in corporate. Corporate, it happens in private, it happens in public health. It happens where you just have those days where you're just here a little longer. So if you do have a family at home, you need a support system to say, like I did, hey babe, I'm gonna be late today. I got this going on and I got this meeting at 8. It's better for me just stay here, do it, and then come home. And he's like, all right, I got you. So I think that Aspen really pays attention to family because we're family here, and they know you have a family outside of here. So I think there's a good balance, but you make the balance what you make it.
Awesome. Thanks. So going along with that, you did talk about how you were with another practice, Aspen. What was your life prior? How does it compare?
So I was in public health, coming straight out of dental school. And it is similar and different. I know that's an oxymoron, but it's similar in the sense that you're going to work hard regardless. Like, you're going to work. You see a lot of patients, you see a lot of people, you deal with a lot of, I'm going to say, characters and characteristics and stuff like that. But however, I will say, so 5 years I was in public health, and I was good. I felt like I was a really good dentist, a really good provider. I've been in Aspen for, like I said, over half a year. And I just felt like my clinical skills just skyrocketed exponentially. For 5 years, I didn't touch, it's public health, so I didn't touch implants at all. And here I am already in part 3 of my implant course, and I'm restoring implants, and it helps that I have managing clinical director. We're both MCDs, and so but she's a little further along on the implant courses than I am. So she's been kind of like a mentor to me. So we kind of teamwork it and get through it. And I'm so comfortable doing it. Before I was like, please don't put anything with implants on my schedule. Now I was like, oh yeah, I got it. I got it.
That's
So and
awesome.
that's being here for like 7 months. So I'm just kind of excited to see where it's gonna go from here.
That's awesome. So does the implant courses that you're taking, is it part of a CE course that Aspen's providing, or is it something you've just done on your own?
Aspen does provide an implant course. I believe, and Ruby, you could fact check me. I'm in the Aspen implant sponsored course. I know that my partner, Aspen partnered with an implant company
Yeah.
to do that course, but then Aspen has their own, and I'm in that one. And honestly, comparing both of them, my partner likes our course a little better. She feels like it's a little bit more in depth. It starts off slow in the sense that as doctors are like, oh, why do I have to know all this microbiology again? Like, and that's what I mean by start off slow, but they're making sure you know why you're doing what you're doing and the science behind it. So I do, for me, I like that all that type of information because I want to know why am I, because patients ask, why do I have to wait 3 months after you place the implant so I can go to the next step? You have to be able to explain osteointegration and healing time and all that stuff to them, and Aspen make sure that you can answer those patient questions when you're doing it. So Aspen, and you get, I think like the first one, the part 1 and part 2, I think was like 30 or 40 something CEs that you get. And in most states, you need what, 10 live and maybe 10 webinar, and it's live. So you got 30 live right there. And it's like, I'm done for the next 2 years.
Right, right. Yeah. So like Dr. Ellis is talking about, we have not only implant CE that's provided by Aspen, in which we partnered with Dr. Rawal, who is like one of implant placing doctors. So he's created this amazing program. But along with implants, we provide Invisalign CEs and just any kind of CE under the sun. And what's nice is the ones that are like provided by Aspen and our like website and everything, it's fully covered. So you really don't even have to think about it. And like Dr. Ellis said, she's just sitting through and getting 30 credits and she's all set. No worries. So thank you. Thank you for talking about that. So let's see, there are so many questions. So when you graduated, so a lot of the people on this webinar, they're students. So it's gonna be a lot of what do I do? What do you think is the best thing? So do you feel like it would be advantageous to complete a residency or go straight into work?
That's a good question. I think it's completely up to you and your level of confidence where you're at. And you have to be honest with yourself and you have to do an honest self-assessment. I didn't do a residency and I'm happy where I'm at. I mean, I love surgery. I'm really good at surgery, but at my dental school, we were heavy on surgery. And I did a lot of mission work where I went to Haiti and the DR and I did a lot of surgery. So and I had a teacher who we pretty much called him GV Black because he honed operative dentistry in us so much that we gave him the GV Black Award. He knew 0.2 millimeter into dentin and blah, 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 blah. So I felt confident in my skill level leaving dental school, where my best friend, she felt like she wanted more practice. And so she went to residency, and it's just kind of up to you. Like you got to do your self-assessment and see, either way, whether you come straight out of residency or whether you come straight out of dental school, there's the biggest thing is going to be the speed challenge. Everybody's going to face that speed challenge. You go from one job to the next. One job might see more patients, and another job you might see 4, 5, 6 patients a day. So it's always going to be that getting accustomed to the speed of that practice. But as far as clinical skills, if you have a good team around you and you're comfortable asking questions, it's really up to you.
Definitely. So going along with what you just said about, it depends on what kind of office it is and how many patients. What does a typical day at your office look like?
So my office is an ACE office. And so that makes a big difference. My office is open 7 to 7. We have 2 MCDs in our office, and a typical day, I mean, we go, like we come in and the patients are here and they're ready to go. And we have time to kid and joke and grab lunch or whatever the case may be. But when we're in there, it's, you have your patient, you have the new patient column you need to be mindful of. You have the overflow column, which is usually like crown seats, denture adjustments, post-ops. You have, if you have an EFTA, which is an expanded function dental assistant, she has her own column, but she can't prep. You got to prep. So you need to do the prep. You still got your patients and you still got to check hygiene. So, but like I said, I have a pretty big office. There's 2 doctors in our office. At my public health office, it was 5 doctors in one office. And it was 5 doctors, 7 hygienists, 13 or 14 assistants. So it don't matter whether you're at corporate or public health or private practice, is your office is going to be based off on how you schedule it. So if you're at Aspen and you come in as an associate or even an MCD and you're looking at the schedule, of course, Aspen kind of has a formula that works. But if you say, hey, you know what, I'm just fresh out, and this is what I did when I came in. When I first came out of dental school, I was doing root canals like every day. Then I went to a new job where they weren't doing root canals at all. So I felt like I kind of lost that skill a little bit. And then I came to Aspen and they're like, oh, root canal and crown prep in 2 hours. I was like, nope, I can give you a root canal in 2 hours. And then we can do another appointment for a crown prep. But now I'm doing root canal and crown preps in 2 hours, but I had to get up to that speed. So it's not like they force you into in fact, they have something called a provider preference guide for when you first join, and they have different procedures. Like, it was kind of overwhelming how much Aspen paid attention to the comfort level of their doctors coming in. It was like, for fillings, how much time do you think you need? If it's a 2 surface filling and 3, I was like, I don't know. I never timed myself. Well, I guess 30 minutes maybe, So typical day to day is what you make it. You can make it as busy as you need to make it, or you could just slow it down, not too slow, but to where you can get caught up and get accustomed to what you're doing. Ruby, you're frozen. I don't know if you can hear me. Mm-hmm. So Ruby froze a little bit. I don't know if y'all can hear me. Hey, you back? You're muted though.
Sorry, guys. It looks like I had some technical difficulties.
I gave Nick permission to talk.
Oh, I'm like, okay, don't know how there's someone here. Are you able to unpermission him? If
I
that's
don't think so. I don't know.
okay. Well, I guess Nick will just
Stay muted.
stay there, I guess. Okay. I'm so sorry, everyone. I don't know what just happened, but yeah, sorry. So please keep the questions coming. It looks like they all went away, but I should have an ability to look back and after this is all done and count how many people, whoever asked whatever questions there were. But that really helped Doc about, your pathway and how Aspen really did care about like how you worked and cared and everything like that. So what made you choose Aspen?
My friends.
Oh, really?
I have a few friends who joined Aspen right away out of dental
Okay.
school. And in dental school, DSOs kind of get a bad rep. So I had my doubts, so I kind of watched them and they pretty much was finally like, look, you need to work closer to home. You have an Aspen in your town. You have an Aspen in the city you live in. Just go in there and see what it's about. And I was like, no. And it was like, go. I don't want to hear nothing about you commuting and missing your babies and da 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 da. And it was like, this is what we're doing and this is how we're living our life and we're living our best life and we're learning and we're da 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 da. And I was like, okay, stop showing off. I'm going.
So were you happy with the transition and everything?
The only thing I'm gonna say that I was not happy was that I didn't do it sooner.
Okay. Oh, nice. Awesome. Awesome. So just to clarify, everyone, Dr. Ellis had talked about MCD. MCD is a lead dentist. So that's just the difference between an associate and a lead dentist. And her office is an ACE office, which means, she's got two lead dentists working, and that allows for the schedule to be a little bit longer and different because they split it on different days. Is that correct? Right?
Yes.
Okay. Let's see. So what is the culture like at your office, or if you go to other offices? Or what was the culture like prior to, and, is there a difference?
So the other offices I worked at, here's the biggest thing I can say. So I worked in public health. So a lot of things were not under my control. It was one of those situations where this is what they want us to do. Well, this patient needs a crown. Well, this is what we have, so we just got to pull it. And as a provider, you're taught, to do what's best for the patient and give the patient all the options. So to see a young 24-something-year-old person and they want you to do a full build-up on number 8 or pull it, and you're like, they need a crown to, for the longevity of that tooth. It's kind of hard. Where with Aspen, I feel like they truly respect you as a doctor, if that makes sense. And obviously you can't go crazy and be making crazy behind treatment plans and hurting people, but they respect you as a doctor. And so the culture that I've gotten here is, as long as you show yourself competent and you can do what you say you can do, and you can provide quality care to our patients, because at the end of the day, you want to provide quality care. This is your office. This is your baby. And if it's a corporate office, it may eventually become your office if you decide to go the POP route. So you need to take care of it. Like I have a POP, like we have owners. And I told my owner straight up, I was like, this is your grandbaby, but this office is my baby. So I am very aware of like what goes in as far as numbers, how the scheduling is happening, who's doing the overtime, with the budget on supply orders. But with that being said, it's a business, but it's a family. So with the culture part of it, like we all just went out 2 Fridays ago, and it was fun. I can't tell you what we did, but it was a lot of it was a lot of fun. And we do that. We have competitions like Halloween, like our office one. We were Ghostbusters, and so we have friendly office competitions, but we also root each other on. We have teams, Microsoft Teams, where they're like, "Hey, come on, Toledo, let's get it today. Let's hear your success stories, or what's up. Let me know something that happened." And if we don't hear from somebody because we're close, like I think in our region, we have about 8 offices in our region. And we'll know when somebody don't check in. And we're like, "Hey, Shanice, we ain't hear from you guys. What's going on? Y'all good down there?" Or, something like that. So we love doing things together. Like we have a prom coming up in April. I know that sounds childish, but we have a prom coming up in April. So
I mean, you gotta have fun. I mean, why not? I mean, it's your family away from
as long as COVID let us, I should throw that up.
right, right. Of course, of course. So I know you talked about, with your schedule and telling them, like immediately when you started, like, no, I need this much time for, a crown prep or root canal. Are they flexible with what exactly you want in your schedule, like your procedures that you want to do? And then also with your personal life schedule, like if you do need to take off, like how does that work?
So I can only speak on my experience, okay, guys, because I feel like my POPs are very different.
Would be
And I
an owner doctor, because all of our
okay,
businesses are owned by dentists. So
so
sorry.
just based off what I talked to of the conversations I've had with my other colleagues in Aspen, and Aspen seems very flexible to begin with, but my POPs, they're husband and wife, and I'm gonna say the best way to explain it is they're very human. So, and they have 3 kids, and they're just great people. So if first of all, you want to be respectful of the scheduling of your time, like, make your emergencies true emergencies. Don't just because you don't feel like coming in work today, all of a sudden it's emergency, you can't come in, because you have people who are counting on you to be there. However, for me, I have 3 kids and 2 of them have a lot of medical conditions. And one of the issues I was having at my last job is I couldn't go to doctor's appointments because where I live, you have to drive to a bigger city to go to some of these major hospitals to get them treated. So a lot of treatment and a lot of stuff were put on hold. And so coming in, I was like, listen, I need every other Friday off. I need to know that I have this day off to make these appointments. And I was ready to fight for my every Friday off. Like I got amped up and my friends told me how to come. And I was like, I need every Friday off. And they were like, okay, we understand. And I was like, that's it. Just okay. So,
Yeah.
so they are very, I would say Aspen is very flexible with your schedule. I mean, we have our set hours and you make your schedule within those hours. Obviously, if you're the only doctor at that practice, it may be a little bit harder to do certain things. But like in my case, the Fridays that I'm not here, we have a doctor cover my, time slot. And Aspen is good at doing that, about getting people to cover for you and stuff like that. Vacation days, I really don't know how it works because I don't usually take vacations like that. Like I don't plan like that. I just know in June or in August or in May, I'm going here and I'm gonna be gone for X amount of days. And I just let them know in advance and they just said, okay, so that they can plan to have those days covered when I'm gone. So how many vacations days and stuff that I have, honestly, I really don't know because I'm always here. But when I'm not here, I'm not here. I'm gone. I'm out the country.
Yeah, it's this, with Aspen Dental, we provide full benefits, full 2-week vacation. Obviously that's negotiable too, but 401k with a percentage of matching, long-term disability, short-term disability, vision, dental, of course. But yes, we provide all benefits, malpractice, all that good stuff. So, you just said, when you're not there, you're gone. But do you ever get calls for emergencies? How does that work?
We do have an on-call system. And so if a patient calls after hours or one of the weekends that you're not open or whatever the case may be, the way it works, we get a text message from the on-call system with the patient's name, date of birth, last visit, and like a brief description of what's going on. And honestly, all we really can do is call that person back, see what's going on. If it's like, hey, I was supposed to get antibiotics and the prescription never came through. A lot of times you have remote access to your desktop or whatever. You can just log in remotely and send the antibiotic. You can call it in, or, you know, if it's like a pain medication that someone forgot to send in, or they just had a procedure and I'm in so much pain, I don't know what to do. You can just go over post-op with them again. And then if it's something that they need to be seen for, then you, at that point, as the doctor, you need to figure out, are you going to direct them to urgent care? Like if they're saying, you know, my head is throbbing, my chest is hurting, I can't breathe, the swelling has gotten bigger, at that point, you need to go to an emergency room. But if it's like, oh, it just hurts, well, what does it feel like? I don't know, it just hurts. Okay, how about on Monday, you come in for a post-op and we'll figure out what's going on. In the meantime, alternate ibuprofen and Tylenol and blah, 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 blah. You go about your spill. And then usually they're fine after that.
Nice. Awesome. So I know briefly you had talked about, you have another doctor that's in the office, another MCD, another lead dentist, and she's been kind of, or is it a she, he, she?
Yeah, she's a she. Girl power.
She's been helping you out with like implants a little bit because she's been there for a little bit longer. Is she your mentor? How did that work? Did you have a mentorship program when you started? What was that like with you, or was it with your POPs?
So because I had been a practicing dentist, everybody gets a training period. It's usually 4 weeks. Obviously, I had been practicing for 5 years before coming to Aspen. So I did have a training doctor, and my training was for about 2 weeks. And honestly, by the second week, I was doing procedures because really I just needed to learn how to work our computer system and programs and stuff like that. But dentistry, I knew dentistry. But for newer dentists, new graduates, it's that 4 weeks just to get you acclimated, so you can learn how to manage a schedule and everything. The dentist that's my partner, which I call like my little sister, because we actually have the same exact birthday, just a year apart. She has been with Aspen longer, but I have been practicing longer. So she was a dentist in India, and then she went to dental school in India. I don't remember. No, she didn't practice in it. She went to dental school in India, then came here, and then was a dental assistant with Aspen. And then Aspen was flexible with her schedule and allowed her to study. And then she was studying for her boards, for her MBDE and all that good jazz. And then she went to dental school here, and then came back as a doctor for Aspen. So she's an Aspenite.
Oh, nice.
And so I think we both mentor each other because she's ahead of me in implants and with the courses and everything. She's helping me a lot with implants. But then with certain surgeries, I guess I mentor her a little bit with it. So we're really like a partnership. So I wouldn't say that she's my full-fledged mentor, but I definitely call her my implant mentor and my guru. But my POP, the husband, Dr. Calderon, he's actually one of the top producing implant doctors within Aspen. So it helps me to have him as my POP. So he comes to the office. So anytime, say my schedule, someone doesn't show up or whatever the case may be, I have no problem. And he has no problem with me just walking in the room and be like, hey, I guess I'm assisting you. And he'll sit there and he'll break down the surgical kits, the implant kits, why we use this, why we use that. I mean, the other day we had a kid come in and we were trying to put it together. And he was practicing, but I called him. I was like, hey, can you FaceTime? We're trying to put this together. He FaceTimed us and he was helping us put the kits and he sent it. So I just feel like with the mentorship program, I feel like that's just a title that's given just to call it something. But most doctors here at Aspen, if they have more knowledge about something than you are, they are willing to help you and pull you forward. So that's what I do like about it. So I'm gonna say it's a mutual mentorship program.
So it's consistent, right? It's a consistent relationship, consistent mentorship. And so someone asked, you had talked about how you've already been practicing. So they were curious about how you became an MCD with only being with like Aspen only for 6 months. But the reason would be because Dr. Ellis has been practicing for a while and has that experience. So
yeah.
Let me see.
But I'm gonna add to that. It can happen. We're fresh out of school you're an MCD. It depends where you go. Because two of my really good friends straight out of dental school started off as MCDs, but they were in like rural area. I can't ever say that word.
I know,
Rural,
rural, I know.
rural areas and stuff like that. So it's not that it's impossible. It can happen. But it's like I said, it also goes with your confidence level. If you go into an interview and like, all shy and timid and I don't know if I can do this, they're not going to put you in a position to fail. They're going to be like, okay, well, you need a mentorship. But if you're in there and you're like, yo, I got this, let's do this, they might be like, you know what? You might be okay to manage this.
Right. So someone asked, in regards to that, you've been talking a lot of hype about Aspen, which is great. It's amazing. So it sounds like there's a lot of pros, working at Aspen. Do you see any cons?
Yes, yes, I do.
Yeah.
So one of the cons that I do see is the fact that Aspen is a DSO already. That's an obstacle you got to climb off jump. Like patients are like, oh, you guys are just about money. This is a corporate, this is a chain meal or whatever. And you have to overcome that obstacle. And it doesn't matter where you go, because in public health, it was, oh, this is the poor person clinic. This is the poor people clinic. Y'all don't really care about us, or, this is people who didn't do good in dental school. And this is kind of where y'all fall. And I'm like, wait a minute. I was like number 4 in my class. I'm sorry. Like, I chose this, I didn't just fall here because this is where, so that's one of the biggest cons. So you have that where those people think that because we are corporate, that we have that corporate big bank take little bank mentality. And another thing too is it's almost like the opposite. Then you get those who are like, oh, this is a big corporate and a set of dentures is going to cost me, the best denture there is going to cost me $12,000 or whatever the case may be. And they expect it to be perfect. No matter what their anatomy looks like, they expect that denture to look exactly like that person's natural teeth on the picture. And those expectations then start to give you problems because their expectation is not realistic. And you're trying so hard to curve their expectations to be realistic. And that is a struggle, especially when I paid $12,000 for these. Well, I'm sorry. Like, I understand what you paid for. You have really good dentures, but you have no ridge. So you need to get implants. Well, I shouldn't have to wear glue if I paid $12,000. Once again, you have no ridge. So it's there is that mentality that you have to overcome, that you're not big bank, take little bank.
Right. Now with procedures and, like you just mentioned, DSOs have a big stigma and everything. I feel like this is another one, and hopefully you can clarify. But the question is, do you have complete independence to make treatment plans, or do they have to be approved?
No, they go treatment plans. Whatever, like is in fact, you get the flow of things here. Like I came in and because I was in public health, I was treatment planning all these MODBLs, like all these big buildups, because that's what I was used to. And no one ever said anything to me. They were like, okay, well, that's what she want to do. And it took to a point where I'm like, oh my gosh, I'm tired of doing all these buildups. These people need crowns. And they was like, then why don't you treatment plan crowns? I can't. If that's what you think they need, then treatment plan a crown. But I don't want them to feel like I'm just trying to crown everything. But if they need crowns, they need crowns. So it became a situation where no one forced me into a certain type of treatment plan. They just let me treatment plan. And as I started like maybe being verbal about some of my frustrations, the other doctor be like, oh no, I would have just extract that. I wanted to pull it, but we were trying, nah, that you're gonna come back, it's gonna break and da 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 da. So now we actually had a meeting where we sat down and we looked at treatment plans and like, how would you treatment plan this? How would you treatment plan that? Well, I would do this. But see, right here, crown lengthening all day. And she was, oh man, I forgot about crown lengthening. That's crown lengthening all day. I wouldn't just pull that. And so now we kind of treatment plan the same. Obviously, we're a team and we're a partner. We're partners and we're one office. But when it's your own office, you treatment plan what you feel comfortable doing and which at the end of the day was best for the patient. And at the end of the day, you're the doctor and it falls on your license. So a non-clinical person can say, oh, well, I know you wanted to do a partials, but we're going to give them full dentures. Wait a minute. I'm the one doing the procedure. Full dentures is not going to work for this person. We're doing partials, and it is what it is. And they'll tell me I had to get used to hearing that. Whatever doc says, go. And I'm like, what? Oh, okay.
Right. So it's not, there's no like dictation by anyone outside of, you know, outside of you and your thoughts and your patient, you know, when you're with the patient. But the only thing is you get to have like an open forum with your other doctor or your POP and, you know, have them, you pick their brain and see if they agree. So are there any procedures you do more frequently than others?
Surgery. I do a lot of surgery and denture deliveries. Aspen is, I think Aspen started with like dentures at first. That was kind of their thing. And then they just kind of branched out to more comprehensive care. But we do a lot of surgery. I do a lot of crowns too. And but in my office, that's just kind of like what my patient population demands. Like I know one office, they do a lot of fillings, but that's what their patient population demands. So it's going to be based off your patient population. We have a lot of, I live in a rural / urban city. So it's like they're trying to be the big city, but they're not. But everybody drinks Mountain Dew and Monsters and da 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 da. And then when they finally come see us, they're like, "Doc, just pull it all." And I'm like, "Yeah, you're right."
Oh, that's great. Now, do you have a desire to become a POP or an owner?
See, the thing is, I don't know. And I'm okay with that. Like, I see my POPs and I kind of think like, if I'm not a POP like them, I don't want to be a POP.
Yeah, they're awesome.
Because, you know, because I want to be like them. And when I mean like them, like not their status, but how they are, like they're still practicing. They know all their doctors. They know all their clinical staff. They know all their administrative staff. Like they're almost, the way we describe them is like, they're the big brother and big sister that everyone is trying to impress because we want them to be proud of you. So, and I know there's some POPs who are miserable, but they could just be miserable people. Like one of my friends, he was on his route to be POP, but he hates dentistry. So I don't know why he was on that route. Now he built houses. He went back to his first love. He's built like 6 houses since dental school. So exactly, right? So
Crazy.
So I will say that if you are wanting to build your career in that direction, the opportunity is definitely there. Like I just know someone who became a POP. And I have a classmate she just opened her second office, you know, but coming out of dental school, she said she was going to open 3 Aspen offices within her first 6 years of practice. So she's on route to do that. Like that was her mentality. She already knew she was an Aspenite even before we graduated. So with me, I'm just getting in there. I'm not in the deep end yet. Yeah. You know, so
Right.
Maybe, but I might be loyal to my POP. So, you know, I don't know.
Right. So like Dr. Ellis just said, you know, the process of becoming one, it's just like she said, her dental school friend who joined Aspen, they had it in their mind that they were going to do it. So it's a mentality. You have to show the drive. You talk to the people you work for, as well as ADMI, Aspen Dental Management, and they'll help you get on that trajectory to becoming an owner. So, sorry, I was asked a bunch of times actually. Do you see yourself working for Aspen until you retire?
I don't know.
Are you like a one day at a time kind of girl? Like
I am a very trust the process type of person. I feel like opportunities come and you just need to recognize which opportunities are for you and which opportunities are there for you to learn from somebody else. So I know that my team has kind of been pushing me in a certain direction. So I don't know, like maybe Aspen might be where I park it. Maybe I might partner with whoever, you know, because that's that opportunity there is too. Like you can find an Aspen and you find a city where you love to live and blah 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 blah, and you become cool with the POP and you work there, and that person, I think one of our doctors did that here. Like he's a partner. So you can become a partner. I mean, I just feel like there's so many avenues, and with I'm still fresh.
Yeah,
So
definitely, definitely. So I'm just going to answer a few questions because I know I can quickly answer these.
mhm.
Can you transfer to a new office if you move? Yes. We work with each other. The POPs talk to one another, even if it's from someone from like Buffalo, New York to, Dallas, Texas or something. So they work with each other, and, work with their associates and lead dentists on transferring and everything. Let's see. We had a lot of questions on referrals, so I'm going to actually kick it back to you.
Okay.
How are referrals handled, and does Aspen have their own group of specialists?
Okay, so we have an oral surgeon who comes to our office once a month, and I feel like that's kind of the gist with Aspen. The only time we really refer oral surgery out is if, say, it's a complicated case where the oral surgeon feels like that person is going to need a follow-up. So since he's only here once a month, it's not in the patient's best interest for him to do the procedure and then bounce. You know what I mean? So we would refer that. But not very often do we refer out to OS because our OS is pretty good. And on top of that, our POP, he's really good at surgery. I love surgery. So that's one thing. Root canals, I will say we don't really refer out either because our other POP, the wife, she does root canals. She loves root canals. She's day in and day out. Why she's not an endodontist, I don't know. So when we see a difficult root canal on this, and we look at it and we're like, yeah, we're not doing that. We put them on her schedule and she busts them out. So that's really what you would refer out is for, oral surgery and endo. If your office is up to you, some offices see a lot of children and some offices don't. It just depends on how comfortable you are. And then the only thing I've really referred out is for pathology, oral pathology, when we need something truly biopsy, like if we think a patient has some type of cancerous lesion or anything like that, and we want to make sure, then we'll refer out to an oral pathologist. Or I had, ironically, like in the past 2 weeks, two special needs patients who were just uncooperative and they needed sedation dentistry. Like they just needed to be put out so everything could get done. And we just don't offer sedation dentistry. We don't IV sedate people to do fillings and stuff like that. So I had to try to find them pretty much a teaching institution that does that. So, but other than that, I mean, you can refer, but we prefer that if you can do it, try it. And if you just
Right.
absolutely cannot, then refer. Like we have one doctor, he just don't do root canals at all.
Right, right. So they have that option though. So if they
Yeah.
don't, yeah. Um, do you, there's a bunch. Okay, so if you feel comfortable not discussing your numbers and salaries, but how exactly does it work with your salary, with profit sharing and daily rate, and what is that? Are you judged only on what you're making? Is it the entire office? Are you fighting for procedures? Are you trying to quickly seat that crown so-and-so doesn't get the credit, or, all that fun stuff? What is it like?
So I would say this, and I learned this very, very quickly, like day 3. Aspen has a number for everything. They have a metrics, a chart for how many steps you take to get to each operatory. They know. But I will say, the way it was explained to me, you get your daily rate. No matter what, you get your daily rate. You can only go up from there. Okay, because that was one thing that I was confused about going in when I was trying to figure it out before I interviewed, because I thought it was based off production and then, whatever it is. And please, Ruby, correct me, because like I said, I came in as MCD, but you get your daily rate. What that daily rate is, it just depends on, negotiation, what your skill level is and all that good jazz. Then once again, based on the office, now I don't know if our POP did it, just like as like an Aspen template, or if they tweaked it a little to match theirs, or the case may be. But like I'm based off a 2 provider office, so our numbers are a little higher than a 1 provider office, because we got 2 providers. So it'll be, I'm just throw out some numbers. Well, one provider office might be like, it starts at 150 to 160, you get 5%, and every 10,000 or whatever, you get X amount of percent. A 2-person office might be 230 to whatever, 5%, and it goes from there. And it just depends on the conversation you have with either Aspen as a corporate, or if you have a POP. So then that's how the incentives work. So it's whatever you make, your profit, minus the budget, what it costs to run that office. Then I think for us, there's a set fee, like administrative fee or something like that. I forget what it's called. It's a set fee that comes out. And then whatever is left of that, so say you were in the 15 percentile, you get 15% of whatever's left times however many days you work. So that's where it could differ. Like if everything is the same, but you only work 5 days, I think you have to work a minimum of 10 days anyway. So say you only work 12 days that month, but then another associate worked 23 days, their incentive check is going to look larger than yours because they worked more days. And that's what's fair. They worked more. So, so that's that case. As far as fighting for procedures, me and my partner, we're equal. And I've heard good and bad where, some people felt like they were getting all the grunt work and whatever the case may be. That's where it comes to where you need to be vocal and you need to say, hey, I'm trying to increase my skills in this. I want to be able to do more of this, or this, that, and the third, because there's a metrics for that. They'll know what you're producing. And a lot of it is not on you. The schedule is the schedule. So if one side of schedule is heavier than the other as far as production, then that's where you need to talk to your front desk staff or the people making the schedule. Like, hey, we need to make sure this is evenly yoked so that it's not heavy on one side. I can give an example where, it was bought, like when I was working and I was doing my review and they were like, hey, so your partner is making a little bit more than you. What do you think is wrong? And I was like, I don't know. I was like, I'm just working whatever on my schedule. And then the next day I looked at the schedule. I literally had, I want to say 12 patients back to back to back. Like I was going for the whole day. And I was probably producing, I'm gonna come up with a number. I don't remember the number. I was producing $1,000. My partner was the late doctor that day. She had 2 patients on her schedule, but they were big procedures, $7,000. So it was like, I'm working, I'm going back to back to back to back. And, so it wasn't like we did it on purpose. It was just like they filled up one column and then they tried to fill up a next column. So we had to retrain our front, like, don't just be filling up columns. Look at the dollar value to make sure that it's evenly yoked. But yeah, that's where communication is key.
Right. So that there's a fair balance and everything. But what is nice with that whole profit sharing model, it's on the entire office. So it's not just Dr. Ellis's production. It's not just, her partner's production. It's the entire office, including hygiene, including when the oral surgeon comes in. So that percentage gets added to that daily rate at the end of the month, which is pretty nice.
Right.
So with your team, your little family that you have, do you get to choose your DA, your hygienist? How does that work? Do you like them? Do you get rid of them if you don't like them? Do you get to choose them? Can they hear us? No.
They can hear us. Well, I will say this. I came into an already established team. And since I've been here, there have been some changes. I know one of my really good friends, and when I mean good friends, like I was the maid of honor at her wedding. We were short and I was like, hey, I got somebody. She's a cosmetologist, y'all. She is now a full-time dental assistant. And but the thing is like, I was just doing which everyone would do when you get it. It's called a Beyond the Chair. And one of the doctors, what he said was, you should definitely be involved in the interview process of everybody in your team. So front desk, assistant and everything like that, because you got to work with these people. And if you off rip, like there's one assistant that I would just say our spirits don't necessarily get along. Like I don't not like her. It's just, I guess I feel antsy when I work with her for some reason. So I don't work with her. And she don't fight to work with me. And we're okay with that. We're okay with that. Like we'll cordial and, we'll talk, we'll joke around. But when it comes to actual working, I'll be like, you. And we're okay with that. So when I first started working here, there was one assistant, like she just kind of clinged to each other, and that was it. And then, then my friend came along too. So it's just like everybody, for the most part, we get along, but you should definitely, you don't want to be that negative Nancy in the office anyways. I am naturally a protagonist, naturally a team builder. Let's get it. And I'm very blunt, high energy. And then there's some people who are just not the one person, she's not high energy at all. And that's maybe one of the reasons why I'm probably too much for her. And that's okay. I'm okay with that.
Right.
So
No,
yeah.
of course. Let's see. Thank you, Dr. Ellis. You've got 1,000,000,000 questions to answer. We'll be done at 8, but yeah, there's so many. I'm trying to pick like a really good one. Let's see. How has COVID been with you and Aspen?
I got with Aspen like in the summertime. So I'm gonna say right when I'm not gonna say the brunt of COVID, but COVID like was heavy March, April, May, June. That's when, a lot of people slowed down. And then end of June, July, people started opening back up.
Right.
And that's when I joined. But it's still been, like probably at your dental schools, you got the COVID questionnaires now, and you got to wear the mask. At my last practice, we were pretty much in hazmat suits. It was bad. We were hot and dehydrated, and it was just bad for our skin. Just, but in Aspen, you have the N95 mask. I mean, y'all can't see me, but I have my N95 mask. I have my something like a shower cap, because I usually wear my cute little surgical caps. But this day and age, with it, got my surgical cap. I have my scrubs. They encourage you to change here and leave shoes here. So I change my shoes here at least. We sterilize and clean. I mean, obviously with everything, sterilization and disinfectant has amped up, but I don't think that, I don't know how bad COVID really hit Aspen. I just know that it didn't hit us as bad as other places. Like I know some businesses, some practices shut down completely. Like they just had to, go down. But it didn't hit us as bad. And I feel like when people are quarantined at home, all they think about is now that toothache that they had for 2 years now. Now all of a sudden it's an emergency. So now we got to treat that toothache that's been hurting for 2 years today.
Right. Of course. So, with COVID and, you getting to know patients because you're new to the office and everything, are you able to build rapport with patients? Like, are you able to see the same patient multiple times? Or is that out of your control? How does that work?
We try to get patients' treatment plan done within 30 days of them stepping into the building. So we see them a lot. And like I said, I'm a very upfront, high energy person. So my patients know me. In fact, they'll, and like I said, I live in a smaller town. They'll see me in the stores and hey, Dr. Ellis, I need to come make an appointment. Well, you remember that feeling you did? It's still holding on. All right, Ms. Johnson. Like let's not talk about your dinner work in Walmart. But so to answer the question, yes, you build good rapport and you build bad rapport. It's not all, it's not all peaches and cream. You have some patients like they are who they are. They don't want to see you. They can't stand you. You don't know what you did wrong. You were as nice as you can be to them. And they don't want to see you. We've had patients call us incompetent. And we're like, why are we incompetent? Well, I Googled this and I don't have calculus that looks like this because on Google, calculus is supposed to look like this. Now, me being who I am, I said, well, calculus is also math, but I'm not saying anything about that. So.
Oh, that's great. So I'm going to just ask one last question, just to help the dental students out, I guess, just any words of wisdom on their journey, their D4 year, especially now with COVID and not seeing a lot of patients, just any advice, anything you'd like to tell them? I guess it's not a question. It's just any profound
Right.
words for the D4 class?
I would say try to figure out where you want to end up. Because if you figure out where you want to end up, then it's easier to get the steps to that end goal. So if your goal is to be a practice owner, then get into those steps of getting there. Try to, get a game plan. If your goal is to, you know what, I just want to test the waters and just figure it out while I'm out there, then be ready to test the waters. Set realistic expectations. Read a lot. I cannot stress that more. I mean, I'm 6 years out, and I'm literally this morning I was looking at some sketchy micro. So just stay up on it, because dentistry is changing, and you got to change with the times. That's why the CEs are there. Like, there's so many new things coming out, and you want to stay updated on it. You want to stay focused, but you also want to enjoy life. Like, don't just shut everything out. Enjoy yourselves. I mean, I was a dental student, and trust me, I know y'all can enjoy yourself. Enjoy yourself, because your best years are yet to come. Like, you think but you have no idea. That day when you pull that one tooth with no help and no one looking over your shoulder, and your assistant is like, yo, good job, Dr. Thompson. You're like, yeah, I just did that, didn't I? Like, when that confidence coming and you're sitting in a chair, like I'm sitting talking to the next, ask me anything, you're going to get there. So don't stress about the little details right now. Just set a goal, plan how you're going to get there, and enjoy the ride. Just enjoy it.
Awesome. Thank you, Dr. Ellis. So I know I said I was going to announce who the top 4 questions are, but there are so many. And plus I need to figure out who asked questions before I shut down and everything. So I'm going to be sending an email with this recording tomorrow. And in that email, I will announce the top 4 questions, or people who asked the most questions. But I do see that there's so many left over. So please feel free to email me. And if they're specific to Dr. Ellis, I'll forward them on to her, and we can, just get them all like dissected, and I'll send them out to you guys again, because I have all the attendees and everything. So I know who you guys are. And what else? I think that's it. Thank you so much, Dr. Ellis, for answering all of our questions. Again, I apologize. I know there's so many, and I appreciate you guys asking so many questions, but I promise I will send out an email tomorrow with the top winners with your gift cards and everything too. And Dr. Ellis, anything else?
No, I mean, I look forward to meeting some of you guys wearing Aspen blue.
Yeah, exactly. And we offer shadowing opportunities and everything. So if you're in your D4 year, still trying to figure out what's next, and you're in Ohio, because I think this is more targeted to Ohio students, we can set something up with shadowing. I know the Cauldrons are amazing and super open, flexible, and all that stuff. And I'm sure they, if Dr. Ellis's office or schedule has got availability, we'll set that up. So
Oh yeah, most definitely.
You can shadow this enthusiastic woman
Don't
right
get scared
here.
now.
Well, everyone have a great evening. Thank you again, Dr. Ellis, and we all will be in touch. Thank you.
Good night.